This is Dr. Miriam Graham from Restore Motion Physical Therapy, and we're going to do some work break stretches. So get out of that chair, go outside if you can. These are really simple exercises you can remember. In time, we'll go ahead and do it together right now. So we're going to start with some shoulder rolls, and I'm coming up, forward, and back, and I'm emphasizing the back because a lot of times we end up slumping forward. So we're doing back. We've done about 8 to 10 shoulder rolls coming forward, up, and back. And now we're going to go up, forward, and down. About 8 to 10 of these, just trying to get the shoulder blades to move on the back, because a lot of times when we're sitting in slumped posture, the shoulder blades get stuck. So speaking of shoulder blades, let's reach up, 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 trying to create space between your rib cage and your pelvis, and then reach this arm up. If your shoulder doesn't allow you to reach up, then you can get the same type of thing by bringing your arm across your chest and kind of separating the rib cage and the pelvis. So if you have some shoulder impingement or pain there, then you can kind of do one of these. And now we're going to bring the arms out to the side and reach a little bit out to the side. So you're just trying to do a little reaching, just changing up your movement. This isn't normally something that people end up doing. And now we're going to take our arm. I'm going to bring one arm in front, the other arm over, and you're going to pull, thinking of bringing the shoulder blade over, across, away from the midline by the spine, and holding. You should feel a little stretch in this area. By the way, none of this should hurt. You're not allowed to hurt yourself. Pain is optional, and no extra points for that, all right? So I do a little hold there. Typically speaking, if you want to think about a stretch, holding for about 5 deep breaths is a good idea, but since we have to get back to work, we're just going to do a little quick movement. And then here's the other arm. We're trying to bring that shoulder blade off the back over to the side. So now we're going to do another one. Bring the arm up. I'm bringing it down so it's about on my spine here, and I'm taking the other arm, holding the elbow, and again lifting to feel a stretch down the side of my body here. So nice stretch there, and come down. The other one, same thing. Lift and reach, 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 reach. So you're getting a little bit of tricep and a little bit of lat in this. And then the other side. It's usually good to do about 2 on each side, but there's no hard and fast rule. Now sometimes you'll find that one stretch is particularly good for you, then you can come back and revisit that, but we're just trying to get a little bit of everything in. Now the thoracic cage, where all the ribs come together with the sternum in the front and the spine in the back, doesn't get a lot of movement. A lot of times we end up doing something like this all day. So I want to have you think of your sternum here lifting as if there were a light, and the light is coming up towards the joint where the ceiling and the wall are. So you're lifting that sternum, and you can accentuate that by interlacing your fingers and reaching your hands down as the chest comes up and your neck is nice and soft. So there's a little bit of a lift there. And then the opposite of that's elephant stretch. So thinking of this as an elephant trunk, you're going to reach forward and let your head soften, and you're feeling the back bow. And again, holding, and then come back. We're going to lift the chest, lifting the chest, shoulders down, sternum up, neck is soft. Reach that light up, and then go ahead and elephant stretch. Now with the elephant, depending on where the elephant's trunk is, dictates where you feel the stretch in your back. And another nice thing you can do, I'm going to turn my back to you, you can angle your shoulder blades when you're doing this to emphasize one side or the other. So it looks like this. And with those, we're keeping the head and neck soft. The head just falls gently forward. Need to pay attention to your neck. If you get any numbness and tingling in your hands, you're probably overdoing it. Let's go ahead and do some gentle neck motion. I'm going to think of like a bobble-headed doll. So a bobble-headed doll is just doing a little bit of rotation here and going to look over my right shoulder And I'm doing this sinusoidal curve to loosen up the joints of the upper cervical spine. Little bobble there. It's usually a little bit comfortable, a little bit more comfortable than just straight side to side. If you're old enough to remember the 80s, it's not Jane Fonda. And a little bit of that. Okay, and now let's go ahead and do neck motion. Again, all of this is for comfort only. I'm thinking of keeping my nose straight forward, and I'm going to bring my ear down to my shoulder. And when I do that, I'm feeling a stretch in this side of my neck. So I feel stretch over on this left side of my neck when I do that, okay? Now, if I want to make this more interesting, I can take my right hand and just gently let the weight of my hand rest on my head. I'm not pulling, I'm letting the weight rest. And I feel a little bit more emphasis of stretch here on this left side. If I want to take it a little further, I can take my hand and reach my fingers to the floor so that I feel even more opening or stretch in the left side of my neck. Now that we've done all this stretching, I'm not just going to flop my head back up, I'm going to help it back up by gently lifting. And I feel a nice sense of elongation in the side, so we're going to do that to the other. Nose stays forward, head tips to the side, bring your arm up, and let the hand rest on top of the head. And I'm breathing as I do this. You got to breathe, it's not optional. And then I'm going to go ahead and bring this hand, and what am I going to do with it? I'm going to reach to the floor, see if I can feel a little bit more stretch in the right side of my neck from the base of my skull down to my shoulder area. Good. And now we're going to do a different stretch. That last one was the upper trapezius stretch. Now we're going to do the levator scapula that goes from the base of the skull to the top of the shoulder blade. So for that, I'm going to turn my head about 45 degrees, a 45-degree angle, and I'm going to look into an imaginary shirt pocket, so like a pocket tee. I'm looking down into this imaginary shirt pocket. I'm taking the hand of the side I'm looking toward, in this case the right. I'm going to put it gently on the back of my skull and let the head come forward, but again, it's just the weight of the arm. I'm not pulling. If I want to accentuate this, I can either reach with my left hand down to the floor. Some people feel a little bit more of a stretch in the diagonal between the base of the skull and the top of the shoulder blade when they do this. Conversely, some people feel more of a stretch when they take the left hand and tap the back of the shoulder blade, because this scoots the shoulder blade out and also accentuates the lengthening of the levator scapula. So you find what works for you. And again, I'm going to let my head come up with my hand. I'm going to turn to the other side. This time I get to look at my logo. Head comes down. I'm looking here. Same side that I'm looking toward. This hand comes to the base of my skull, and I'm doing a little bit of resting of weight here. Work with gravity. And then I can either reach down with the opposite hand to feel a stretch from the base of the skull to the top of the shoulder blade, or I can take this hand and pat the back of my shoulder to sweep the shoulder blade out of the way to get a little bit more stretch in those levator scapular fibers. Good. And again, when I'm done, I'm going to bring my head back up to neutral so that there's no issue there. All right, so let's get into the thoracic spine again. We did the elephant and the reach up stretch before. Now let's go ahead and think of moving the rib cage all around. So you want to think of bringing it forward and bringing it backwards. So I'm thinking of moving the rib cage between the shoulders as opposed to moving the shoulders on the rib cage, which is a little bit more common. So really just play. It's fun, just play with the movement. See if you can get a little bit of movement of bringing the rib cage forward and the rib cage backwards. And now that you have that, let's change it up. I'm going to have you put your hands on your pelvis. You're trying to keep your pelvis still. And you're going to bring your pelvis or rib cage over rather. So you're trying to go side to side, and you get a little bit of stretch in the side of your body in the trunk. And now let's put those motions together to make a circle. We're going to go clockwise first, okay? So I'm bringing my chest forward, over to the right, back to the left, and forward, again, forward, side, back, left, once more, forward, side, back, and left to neutral. Let's go 3 counterclockwise, so forward, left, back, right, forward, left, back, right, forward, last one, left, back, right, and neutral. You can smooth those out and maybe even try doing some figure eights. It's just fun to play because, again, you just need movement. We're going to take that same movement down to the pelvis. So I'm going to have you stand about hip width apart, just comfortable width apart, and bend your knees slightly. And I'm going to have you put your hands on your pelvis so you can feel the movement there. And you're going to just bring one hip up and then the other hip up. It's a little bit like having your hips be the clapper of a bell, and you're just moving them side to side. I'm trying to keep my upper body still while I move the lower body, so I'm getting some disassociation between the upper trunk and the lower trunk. And now I'm going to turn sideways so you can see. You're going to bring your pubic bone forward and then stick your tailbone back. So we're going forward and back, just getting all the cardinal planes of movement, north, south, east, and west. And then again, just like we did with the thoracic clock, we're going to do with the pelvic, and we're going to do circles. So I'm going to kind of do diagonal so you can see. We're going to go forward, to the right, back, to the left, and forward. I'm trying to keep my upper body still, so there's disassociation between the upper and lower trunk, which is really helpful for all sorts of things. And that was my third one, so now I'm going to go 3 counterclockwise, so forward, left, back, right, forward, left, back, right, forward. I think I've got one more, but I'm really bad at counting. All right, so now let's go ahead and bring our forearms and even hands into this. You can take your hand with fingers down and then avoid your thumb here. We're going to get to the thumb later. It's pretty special. So you're going to bring your fingers down back towards you, and this stretches the top of the forearm or the wrist extensors. These are the ones that let go of things as opposed to grip. I'm keeping my elbows straight. I like to keep my arm down and keep that shoulder out of my ear. You can also bend the elbow, and you get a different stretch with that. So you can toggle back and forth between elbow extended and elbow bent. And again, you're breathing, you're just finding what works for you. Sometimes doing a little twist here. You can find an area it's needs a little bit more attention, and that's good. You want to give it attention, but you're not allowed to hurt yourself. All right, so we'll do that on the other side. So forearm, we're going to get the top of the forearm, fingers down. I'm avoiding the thumb, leaving it out there on its own, keeping my arm straight, elbow bent, elbow straight, just toggling back and forth to feel the stretch in the wrist extensors. These are the muscles that let go, and they need to be in balance with the muscles that grip. That's what we're going to do next, because if you're typing or writing with a pen, those are probably very tight. All right, just do a little shake. A lot of times shaking will help a lot in the middle of something. All right, so now you're going to take your fingers up, and you take your hand back. Again, we're leaving the thumb out, and I'm bringing my fingers back towards me, and I'm feeling a stretch in the front part or the volar aspect of my forearm, feeling a stretch there in the wrist. Now, none of this hurts, and it's not a competition to see what it's supposed to look like. You go by how it feels. So some people have more flexibility than others. So my fingers might be back further than yours, and that's okay. It's not a contest. So I just feel a stretch. Good, good. That's a little stretch on that side, a little wiggle. Try the same on the other side. Fingers up, hand over the fingers. Bring that back so that you feel a little bit of stretch in the front part, the inside part of your forearm. And these are the wrist flexors, and they're usually pretty tight because of all the gripping we have to do. Gripping a pen, typing on the keyboard, picking up stuff, carrying around. Good. The latissimus muscle goes from the armpit region all the way down the back and starts to mirror the fibers of the glute on the opposite side. It's a really important muscle, and when it's tight, it'll pull the shoulders forward. So you're kind of like this, and it's not going to be helpful for good posture. So we want to stretch it out. My favorite is using a door jamb. So I'm standing, my hand is at the door jamb, and I'm using the same leg and arm here on the door jamb. My weight is on the front leg, and I'm coming back. So this is just here for balance. And I'm thinking of arching my back up like an umbrella towards the ceiling. So I'm kind of arching the upper back, and I'm going to feel more of a stretch here by the upper part of the lat fibers in the axillary region or armpit region here. I'm just going to stay here for about 5 deep breaths, and we're pretending that's the 5th breath. And so now I'm going to come down a little further and turn to look up under my shoulder. And now I feel the stretch here in the lower part of the lat as it joins in with the pelvis area. And again, 5 deep breaths. So that's a latissimus stretch. And that will help you open the chest so that you can be more upright rather than internally rotated and flexed. We're going to do a pectoral stretch, and the pectoral muscles are in the front of the body. When we do a lot of sitting and typing, keyboarding, writing, we tend to slump forward, and if the pectoral muscles are tight, it's really difficult to come up tall into proper posture. So this is a very easy stretch. We're here to door frame. I'm going to put my hands just about head height on the door frame and keeping my trunk in alignment, meaning I'm not arching my back or twisting. I'm going to step forward with one leg, and passively, as I move through the doorway, my arms are stretching. I feel the pull from my arm to my chest. I do not feel pain in the top or back of my shoulders. And I'm going to stay in this position and do 5 deep breaths. As you do the breathing, your rib cage expands and contracts. So on the expansion, you're going to feel more stretch, and on the exhalation you won't feel as much. So you just want to go to what's comfortable for you. Again, 5 deep breaths is a good one. You can come out, shake out a little bit. Does not matter if you switch legs or not, just like symmetry, so I'm going to do that. And again, this is the pectoralis stretch. I think I mentioned that one side might be tighter than the other just because you might have a dominant arm. If you find that you want to give that one arm a little bit more love, it's okay to go ahead and put the hand on the door jamb and step forward with one arm so you can really concentrate on the one side. But this isn't competitive stretching. You just want to feel an opening of the muscle, an elongation of the muscle, so that that opens the chest and allows you to come upright with that sternal lift. So again, you can come back to any of these and do them later. We're going to take a little break and do some leg stretching to connect the upper body and trunk with the legs and pelvis, because they're interrelated, and it's really important, especially for sitting, to have good pelvic and lumbar control and flexibility so that you don't put undue stress on the neck and shoulders. One of the things that gets compressed when we sit are the hip flexors. These are muscles that go from the base of your rib cage, like rib 12, down through your pelvis and lumbar spine. And one of my favorite ways to stretch the hip flexors is half kneeling. I always want you to have something under your knee to pad it. So let's get started. I'm going to have you put one knee on your pad. Your other foot is going to come forward. Keep your pelvis square, as if the front of your pelvis were 2 headlights of a car. You want to make sure that they're square forward. And then the knee in front is open a little bit greater than 90 degrees. This gives you somewhere to go. From this position, come up nice and tall in your body. Stick your bum underneath you and squeeze your glute. From here, you can glide forward, keeping a long spine, and feel the stretch in the front of your hip area. Come back, we'll do that again. So it's a tuck, squeeze, glide forward. Feel the stretch and come back. One more. Tuck, squeeze, glide forward, and you're feeling the stretch here. If you're feeling the stretch down here, your quads are probably tight. You might need to stretch those again. So let's go ahead and switch legs. I'm just going to go ahead over onto the other knee. Again, greater than 90-degree difference. Tucking my tailbone under, squeezing the glute by making a muscle, and coming forward. You can accentuate this with an exhalation. So what that looks like, you're going to tuck under, squeeze, exhale. Keeping your back nice and long. One more, tuck under, squeeze forward. Don't let the back arch. That's when you let go of the glute. You've got to make sure that you keep the glute engaged and you only go so far and the back is nice and long. An alternative to do the hip flexor stretch in half kneeling is to do it in standing. You can put your foot up on a chair, giving yourself enough room to rock forward. Tuck your pelvis underneath, squeeze the glute so that the pelvis is locked into place, and then you glide forward, feeling a stretch again in the top of the thigh by the hip joint. This is the hip flexor, and come back. So again, that movement is tuck, squeeze, glide forward, back is long, and come back. Once again, tuck, squeeze, glide forward, back is long. Feel a stretch in the hip, no pain. And then we'll go ahead and switch sides. So again, I'm giving myself greater than a 90-degree bend here so that I have somewhere to go when I glide forward. Coming up tall in the body, tuck the pelvis under, squeeze the glute, come forward. Feel a stretch in the front, in this case of my right leg, and then come back. Pelvis bones are forward like two headlights of the car, coming forward. And then one more. Tuck under, squeeze, glide forward. We're going to do a stretch for the piriformis muscle now. And even though we're supposed to be getting up and moving around from sitting, this muscle can be stretched in sitting. So I'm going to have you scoot to the edge of your seat, so your sit bones are on the edge of your seat, and you're going to cross your left ankle over your right knee. And I'm turning the leg out a little bit. It's okay if it's up here, but you just want to kind of turn that leg out a little bit. Now from here, come up nice and tall in your spine. You're engaging your core, and again, you're thinking sternum over shin. So I'm coming up nice and tall, and I'm hinging from the hips to get the stretch in the buttock of this leg. I'm not scrunching like this to get it. So just be mindful. You want to come up nice and tall, engage your abdominal muscles, come forward, feel the stretch in the buttock. It should be a nice stretch, a nice feeling of release, maybe a little tender. If you're very tight, you might feel a little bit of inner thigh stretch as well, but it's not necessary. And you want to take about 5 deep breaths here. An alternative, if you're in a meeting and you don't want people to know that you're stretching, you can come up nice and tall and think of sending your tailbone back. So I'm here in my meeting and I'm sending my tailbone back because I'm arching the low back. I'm still getting a little bit of a stretch. So let's go ahead and do the other side. I'm crossing my right ankle over my left knee, coming up tall, thinking of chest over sternum, reaching that chest forward to feel a stretch in the outside back of my right leg. And again, holding for about 5 deep breaths. We're going to stretch the back of the thigh, the hamstrings, and I'm going to use a stool to help with that. You can use a turned over waste paper basket, a tree stump, a ledge, maybe even a yoga block. I'm going to stand on one leg and put my other heel on the stool, and I'm bringing my toes back, toes to nose here. Coming up nice and tall in my body, I'm thinking of bringing my chest shin to shin or chest over shin to feel a stretch in the back of the leg, and holding for about 5 breaths, and then coming out. And we're going to try the other leg, same thing, lifting up, coming forward so that you feel a stretch in the back of the leg. And I'm really trying to keep the crown of my head and my tailbone in the same plane. I'm not slumping from the waist. I'm really trying to fold from the hips. So that was one on each side. Back to the first side. Come up nice and tall, engage your abdominal muscles, reach forward with the chest, or you can think of bringing the tailbone back, whichever works for you. Feel a stretch, some elongation in the back of that leg. And then you can go ahead and do the other side. Last time, reach tall in the body, come forward to feel a stretch in the hamstring. Hamstrings are important because they are shortened when we sit, and because of their attachment to the back of the sit bone and the sacroiliac joint fibers, they can destabilize the lumbar spine when they're too tight. The quad muscle is on the top of the thigh, and if it's tight, a lot of times you can't even feel your hip flexor. So let's stretch the quad. I'm standing. I could hold on to a chair or a wall if I needed extra balance, but right now we're just going to do with what we have. I don't have something, so I have to be on my best behavior. I'm going to bring this leg up, and if you couldn't get the leg, you could hold on to your pants cuff, or you could hold on to your shoe, but I'm just going to hold on to my foot. From this position, doing the same thing that we did with the hip flexor, tuck your bum underneath you, squeeze the glute so that you're keeping it still, and just try to bring your heel towards your buttock. So you're feeling a stretch in the front of the thigh closer to the knee. Now notice I'm not having the knee in front of the body or out to the side. I'm trying to keep it pretty much right in line with the other leg so that I isolate the stretch to the quad, and I am making sure that I'm keeping my bum tucked under so I have a nice long low back as opposed to sinking and arching the low back. So you want to keep that up and engaged. That was too long a hold on that side. Let's go ahead. You just went about 5 breaths. So I'm picking up the other leg, tucking the bum under, elongating the low back, and bringing the heel closer to the buttock. Little hold there. I'm not sinking in the other hip. I'm up nice and tall. Again, I could be holding on to a wall. Tall friend, just hold on. There you go. And we'll do the other side again. So I'm lifting, tucking under, squeezing the glute, and bringing the heel back towards the buttock. Shoulders down. Don't have to have my shoulder hiked here. Good. And then let's go to the other side. Last time on this side. Again, long spine, knees are closer together. They're in the same plane at least. Feel elongation there. Good. Another stretch you're going to do is for the inner thigh muscles. The inner thigh muscles are called the adductors because if you add them together, you get 2 legs, as opposed to the hip abductors, which abduct away from the midline. So to be clear, we're going to be stretching the inner thigh. I'm keeping my toes pointing towards the camera. I'm standing further than hip width apart. That is comfortable for me. And now in this position, I'm going to lean, keeping my knee over my toes so that I feel a stretch on the inner thigh from my pubic bone down to the knee on the elongated side here. And again, you could hold on to something if you needed to. Let's come over to the other side. Same thing, so my toes are facing forward. I've got the knee over the toe, and I'm feeling elongation from the pubic area all the way down to the knee. And let's go to the first side again, feeling a little stretch there. I'm leaning forward a little bit, that's just for balance. And last time on the second side. Now we're going to shift that a little bit. I'm going to lift the toes of one foot. Again, knee over toe on the supporting side. This is the side that we're feeling the stretch, and it's the inner thigh and a little bit of the back side of the thigh. And then up, and then again, toes up, come over. I'm leaning forward for counterbalance. I'm thinking a little bit of maybe butt back to get a little bit of inner thigh stretch. Same thing over here. So this is the second side, second time first side. And then come on up. You can hold on to something if you need to, a chair, a countertop, stool, just something for balance. Let's talk about adductor stretching. They can be a source of discomfort, creating dysfunction in walking, such that it will tug on the joint of the pubic area and make it very difficult to have a smooth gait, which can cause other issues. So they need to get a little bit of love. So I'm sitting on a little rolled up, this could be a rolled up mat, I'm sitting on a posture block, but if you have your bum up higher, then it's easier to get your adductor to extend as opposed to being on the floor. It's just hard to get your back in the correct position. So having your body up a little bit helps you get into a better position. So when you're doing this, remember, it's not about what it looks like. You don't need to look cool. You just need to feel it in the muscle. You want to meet your body where it is. So starting with having one leg out is a little bit more gentle. There's less stress on the sacroiliac joint. And you just want to think of coming up nice and tall and bringing your chest over your bottom leg. And you can get a stretch in through here. Now, what you're doing with your foot also makes a difference, because if you have your foot toes up towards the ceiling, that's one kind of stretch. If you rotate your leg back, kind of back towards the back window, it's going to be a different kind of stretch. Another tip is to gently bend and straighten the knee, because that allows the nerve and muscle to glide through. And you want to think about this, maybe about 5 deep breaths on both sides. I like the stretches where you're doing a little bit of movement as opposed to the static stretches, because it makes the comfort greater. So adductor stretching continued. Again, I'm on a little block, and have your feet together, and then just let your knees come out to the side. And if one leg goes down further than the other, that's okay. Sometimes it's helpful to maybe use some pillows or something to prop up under your knee. You can also just let that leg come down, kind of hold on to your ankles, wiggle closer. You're not allowed to hurt yourself with this. It's just supposed to be a pleasant stretch. And this would be an example where we're using both legs at the same time as opposed to the one. Having a coffee table, an ottoman, a stool or something to relax your legs on can be helpful as well. So if you're lying down, your bum is up against the surface, and then you can let your legs soften being supported. The benefit of this is that your back is supported on the table, and you can just let your legs be soft rather than holding them. Again, if it's tight, you can put a pillow or something under your knees, because you want to be able to soften and breathe through the pelvis out into your legs. And so adductor stretching.